distinguished press colleagues, senior fraternity of Manipal, our doctors who are here, and everyone else from the administration side. Today, Manipal Hospital is extremely happy to be in Mizoram, where today we have a lot of patients coming into our hospitals in Kolkata. Currently, we have 38 hospitals in India. Going forward, we are with the acquisition and merger of Shiadri Hospital, Pune, we would be around 50 hospitals. So today, as we speak, Manipal Hospitals as a brand, as a chain in the healthcare space is leading the way forward. Today, we are tied up with the health scheme of Mizoram. We have patients coming for our oncology services, and today it gives me immense pleasure to let you all know that we have three very big stalwarts who have been in the oncology space working for years together and have been able to take care of all the patients who come from Mizoram to our facility at EM Bypass, Manipal. I would take a minute to introduce them. I'll start by Dr. Saurabh Datta, who is our Director, Manipal Oncology Services and Senior Consultant, Head and Neck Cancer Surgery, Manipal Hospital's EM Bypass. I'll request Sir to please come on stage. Sir also just take care of our Salt Lake and Siliguri units and also Broadway. So Salt Lake, Broadway and Siliguri EM Bypass, these are the units which Sir looks into as the Director and Head and Chief for Oncology. I would request Dr. Kingshuk Chatterjee, Consultant, Head and Neck Surgical Oncology, Manipal Hospital EM Bypass, to come on stage. And last but not the least, Dr. Arunava Roy, Senior Consultant, Gynae Oncology and HOD for our Gynae Oncology Services. Request Arun, our Regional Head for Marketing East, to also come on the dais, please. And Ms. Shoma Chakraborty to also join us. She's part of PR branding and she is part of Arun's team. Thank you all for taking out time. And I would request Dr. Datta to please come and say a few words. Thank you so much.
Good afternoon. I don't know who should welcome whom because we are guests, you are the host. This is my first visit to Mizoram, and when I was coming from the airport, I realized one thing. We always discuss in our hospital, because of the government tie-up with Mizoram, a lot of patients are coming to our hospital, and some of them I can see now with family members. Now so we always discuss that, and we treat cancer patients only, mainly cancer patients. So all are in distress. But whenever we see a lot of Bengali patients, Bihar, Jharkhand, neighboring all states. But whenever we see Mizoram patient, one thing you will always see. Whatever in the distress in them, they will have a smiling face. And so in any way, you cannot beat their spirit. That is the reason probably a small state like Mizoram with 15 lakh population, and we all from, Arun is from Bangalore, we are from Kolkata, and I am sure from everywhere people are coming. It's not only to say what we are doing, but coming to Mizoram actually gives us oxygen, so that we can also smile like you. And In our hospital, we are a comprehensive cancer center, and we are treating a huge number of patients. Exact data I think Devraj or Arun will give. And so we have everything, whatever is required for a cancer treatment, starting from high-end radiation machine to robot. We have with us Arun. He is an icon for robotic surgery in the entire world. He has been recognized from every part of the world for his skill in robotic surgery. We have all organ-specific treatment. That means one surgeon, he doesn't do oral cancer. I know you have a lot of oral cancer patients because of your smoking and chewing habit. There are gynecological cancer, esophageal cancer. Highest incidence is in Mizoram in India. So this is all for these habits. So we have everything, different departments. Like we only do, myself, King Soup, Dr. Horse, our team only does head and neck cancer. The patients, I can say, they know us. And there are department, Arunabhu, they only treat gynecological cancers, ovarian cancer, uterine cancer, cervical cancer. There are departments like uro-oncology, they only do urology related cancer. There is on orthopedic oncology, they only do bone tumor, soft tissue sarcoma. This. So breast cancer department, they only treat breast diseases. So this is one thing, very few centers in India they have, and we are proudly saying we are. And one more thing, that almost the entire team are from Tata Memorial Hospital, Mumbai. We all together are, and or there are very very famous surgeons who are consultant at Tata Medical Center in Kolkata. They are like Karunavu, he was a consultant there. He has also joined with us. So this is a very compact team, and I don't know. I would request. We are trying our level best. Look, I always say to our patients when they come to us, we don't know. We are just human beings. We treat patients. Ultimate, every outcome is not in under my control, especially in cancer. But every time we say our patient one thing, that when they ask that what will happen, so we say that cancer, nobody can give you guarantee that I am operating, never it will come back. That is the reason everybody is scared of. But I always say that, look, we are sitting in this side of the chair just by fate. Tomorrow I can go to that side, I can become a patient. So when we treat patient, every time we keep it in mind, all of us. Every day when we discuss, every time we discuss that any time we can be our patients. So when treating any patient, it is our first thing that if it was to my family member, what would we have done? We will do the same thing to our patients. And I will request some of the patients to share their experience. If we have any fault, we are really ready to correct it. I really want their feedbacks, and it's not in a closed door. So we requested them to come and to tell in front of us, all of you, that if we have any fault, tell, we will be ready, and whatever you liked or disliked, we really want to know from you. And lastly, this is, we are not here just to treat the patients of Mizoram. You know, the highest success is when we will not get any patient from Mizoram. If we can eradicate cancer from this part, then that will be a success. And as a Manipal group, our aim is not to get patient from Mizoram. Our aim is to stop going patient from Mizoram. And for that reason, we will work hard. This is just a relationship we have built. The treatment of patient is small part for us. our aim is to two things: to establish the treatment here so that the patient should not go. The people of Mizoram can be treated in Mizoram, and second, we have to stop the habits which are causing cancer. And this will be not one day program. I will not tell in detail. I will request the room to tell. But we are coming up with that project where we will fight it out to eradicate or to significantly reduce the cancer burden from Mizoram, and that cannot be done without the help of you. Thank you. Thank you very much.